Your EHR isn't responsible for your burnout. There, I said it. That's right. Your EHR isn't responsible. It isn't your EHR's fault you're burnt out. Granted, your workload is a driver of burnout, and the EHR is a big part of that workload. However, your EHR is just a machine. It just handles information. Information you put in, information comes out. That's all the EHR does. It simply manages information. Now, research shows that if you want to change your workload, you must have conversations around that workload. You must communicate and set boundaries. You have to know what you want, how to say it, and you have to say it in such a way that values everyone at the table. I know it's my EHR, you say. All that time spent documenting meaningful use is taking me away from patients. It's taking me away from my family. Yeah, I get it. I acknowledge that the data shows that meaningful use documentation adds hours to our day with minimal return. It almost never changes how we treat patients. I agree with you and with everyone else on that. However, this has been the case for 15 to 20 years. And most of you have never had a single constructive conversation around that. I'm not saying you haven't had a conversation around it at all. You've probably sat in the doctor's lounge and vented. You've gone to the bar and vented. You've even vented to your family and friends. But you haven't had a constructive conversation with anyone who can bring about real change. So how do we change that? How do we get you involved in conversations that will bring about change? And we need massive change. So to get massive change, we're going to need massive involvement. Everyone who is affected by this unnecessary data entry needs to get involved, needs to speak up. So get informed. Learn who the players are. Learn about the EHR companies. What are their pain points? Find out about their competitors. Find out who their representatives are for your organization. Speak with those representatives. Get to know those representatives. Learn all you can about their competition. Inform yourself about the concept of unnecessary data entry. I mean, we know about the gestalt of unnecessary data entry because we live it every day, sometimes 7 days a week. But find out about the actual definitions of both legally and medically about unnecessary data entry. Who else could be doing this? I mean, seriously, who else could be doing this? Having a physician do data entry is expensive and illogical. Surely somebody else could be doing this. And if not, then let's find a way to make this efficient and, frankly, easy. Find a way to make it fit into the workflow. Talk to your IT people in your organization. They may know the EHR reps. Well, they probably do know the EHR reps. And they may know some low-hanging fruit about how to change EHR utilization. They may have been working on this problem behind the scenes and know the first steps, first 2 or 3 steps even, to get this changed. And then talk to your medical association. Is there an EHR utilization task force at your local and state medical association? If not, there needs to be. Will you be on it? And if you don't feel that you can be on it, will you support and start the initiative to set up such teams, such task force? Honestly, there needs to be an EHR utilization task force dealing with this at every level, at the local, the state, and the federal level. And at the federal level, it needs to be interacting with the meaningful use people in DC. This is how we work on change. And if you're not going to be on the task force, will you at least be supportive of getting those task force and those teams starting? And then know what you want, know how to say it, have everyone at the table, or at least represented by someone at the table, and then speak in a way that values everyone at that table. This is how you get sustainable change. So how do you know you're speaking in a way that values everyone at the table? I thought you'd never ask. This is where you get to the nitty-gritty. You have to know their values. You have to know their personality code, what I call their bank code. And if you don't know your own bank code, then you can go to my.bankcode.com and you can learn your own bank code in less than my.bankcode.com/beat-burnout. It's BEAT-BURNOUT. And you can learn your own bank code in 90 seconds or less. And what you'll see are 4 tiles like this. And on those tiles, they will each have 12 values. And these values are important. This is how you learn about the other people at the table. When I coach people, I have them learn or memorize all 48 values. In a conversation, you want to be able to listen for those values and you want to be able to speak those values. When you listen for those values, people feel heard. They feel like the problem at hand that's so incredibly important to them is now important to you as well. That's why when you go to the table to speak about meaningful use and how much time it's taking up in your EHR, if you speak to someone in their values, that's how you get heard about this topic or any other topic. That's how you get your boundaries set on this issue. It's by speaking about an issue that's incredibly important to you in their values. It's that simple. This is how you get boundaries set. This is the system for it and the process. So I know not everyone who watches this is going to go out and start a task force on EHR utilization and battle meaningful use. I get that. But perhaps they'll reach out to their IT team and find a way to speak to the EHR representatives. Perhaps they'll talk to their local medical association and find a way to support a task force or help them develop a task force or support the people who are already on a task force. If we all took a little responsibility and did something, we would move systematically closer to the goals of making meaningful use easier and spending less time each day in our EHR. And I think that's important to all of us. If you want to know more about bank codes and personality science, then just reach out to me. I'm here to help. I'm Dr. Nan Nessel of Beat Down Burnout. Thank you.